My name's Hannah Davis, and I'm from the Patient-Led Research Collaborative, which is a group of researchers who are also long COVID patients. Next slide, please. So what do we know about post-COVID-19 condition? We've seen over 200 symptoms documented in multiple organ systems, including gastrointestinal, neurologic, cardio, respiratory, immunologic, and many other types of symptoms. It's a multisystemic illness. There are severe impacts on work, ability to self-care, daily activities such as driving, communicating, watching children, and the quality of life is low. Many patients have difficulty even with walking and having conversations with others. Symptoms persist for over a year. In general, patients experience 14 symptoms after month 6. Relapses are common. Relapses meaning where symptoms increase in number and severity for a period of days to months, often on physical or mental exertion, but also after other triggers such as certain food or substances, or during menstruation in menstruating people. Cognitive dysfunction and memory loss are common symptoms and are equally common across age groups, and this can occur after mild COVID-19, in which patients were not hospitalized. Many patients are not hospitalized. Next slide, please. Early speculations about the pathophysiology include vascular and endothelial dysfunction, immune dysfunction, brain and brainstem inflammation, residual damage of ACE-infected tissues, vagal and autonomic neuropathies, ongoing immune stimulation from reservoirs of persistent infection, chronic perturbation of immune subsets, activation of an autoimmune response, or organ damage, and these are likely overlapping. Next slide, please. We have knowledge gaps in the area of clinical characterization and definition. We need a case definition. We need to create clustering and phenotyping patterns, especially using large, comprehensive, multisystemic symptom data sets. And we need a better understanding of the timeframes, the short, mid, and long-term consequences of this illness, and the patterns of disease, whether it's persistent, fluctuating, relapsing, and how it does these things. Next slide. We also have key knowledge gaps around epidemiology, including the incidence and prevalence, especially in different regions, the risks among different subpopulations, including those outpatients with mild disease, the hospitalized, and those critically ill, polysymptomatic patients, vulnerable populations, including children, ethnic minorities, and marginalized populations, and the risk and protective factors that factor in, including variants of concern, age, ethnicity, chronic conditions, vaccine status, and the severity of the acute illness. Next slide, please. We have knowledge gaps around the management, including the role of therapeutics, including antivirals, monoclonal antibodies, immunomodulators, antithrombotic medications, and antihistamines. We need to understand the rehabilitation pathways, including cognitive, speech, occupational, and non-physical therapy-based rehabilitation. The models of care continuity, including community-based care, home care, and case identification in those not hospitalized in particular, and appropriate diagnostic pathways, especially those that guide management decisions. Next slide, please. So the overall objectives for the global research roadmap for post-COVID-19 condition include building on existing post-viral research to identify post-COVID-19 pathophysiology, identifying appropriate and accessible diagnostics to establish diagnosis and to guide therapy, and to identify management strategies that improve patient-centered outcomes. Next slide, please. There is a lot of research in post-viral illnesses such as myalgic encephalomyelitis that has been done over the past few decades, and especially in the past few years. We need to coordinate with existing researchers, organizations, and experts in these fields, many of which are less commonly known. By building on this existing post-viral research, we will be able to get a head start on finding the pathophysiology and eventual treatment and cure for post-COVID-19 condition. Thank you so much. I'm going to turn this over to Dr. Regis Rosa for the latter half of this presentation.